I am here today to talk about breast cancer. Do you know that both men and women develop breast cancer? Breast cancer is important to understand. How it happens is important to understand. What factors increase our risk of breast cancer? According to breastcancer.org, everyone needs to understand breast cancer a little more. And they need to understand how it develops and what the risks are for developing breast cancer. Breast cancer is an uncontrollable growth of cells. Our genes are the command center for our body. And mutations develop in the cell's nucleus. And your cells can be turned on. The mutation can turn on a growth or turn off a growth. And abnormal changes occur because of a growth in the gene being turned on. And these abnormal changes turn into breast cancer or a tumor. Now, a tumor can be benign, and benign means that it is non-cancerous. The cells look very much like a healthy cell, so it's a tumor that starts but doesn't spread to other tissue. A malignant tumor is a cancerous tumor, and that is a tumor that the cancer begins to grow outside of that tumor and into other tissues of the body. A malignant tumor can spread beyond to other tissue, and about 1 in 8 U.S. women will develop breast cancer. 1 in 1,000 men will develop breast cancer in a year. Last year, 2,360 men were diagnosed with breast cancer. The statistics are frightening. If you hear the statistics in the way that it says 1 in 8 women, you will develop breast cancer, you get the idea that if there were 8 women in a room, that 1 in those 8 women would develop that breast cancer. But don't look at it that way, because if you look at the period of 1 to 80 years, then that is a long period of time, and your chances of developing breast cancer in that 80 years is only about 12%. So that means 88% of women will never develop breast cancer. The statistics tend to frighten you, but it is important to know that there are severe risks. So what might be some risk factors of breast cancer? A factor is anything that increases the risk of breast cancer. Some of the risks we can control ourselves. Some of the factors, weight is a factor, our body weight. And we know that the higher fat content we have on our body, it increases our chances of not only breast cancer, but all cancers and heart disease and many other ailments that develop in the human body. Breast cancer is one of those ailments. So weight is an important factor that increases our chances of breast cancer. Diet also contributes to being overweight. So low-fat diet, a less amount of red meat in our diet, these are all diet-conscious actions that we can take to keep ourselves healthy and our weight down. Exercise reduces the risk of breast cancer. Getting some sort of exercise every day, every week is important for healthy weight, but it also reduces the risk of breast cancer. Eliminating smoking and alcohol consumption is very important. Smoking increases the risk of breast cancer dramatically, according to the American Cancer Association. Eliminating smoking and eliminating alcohol consumption will help dramatically in reducing breast cancer. Those were risk factors that you could control. Now we are talking about risk factors that you cannot control, and those would be age. Age is one of the biggest factors. You cannot control age. So as we get older, our chances of breast cancer increase. Our gender is something that we cannot control. A woman's activity of hormones like estrogen and progesterone puts them at a higher risk for breast cancer. Breast cancer symptoms vary from swelling in the breast to different changes that may occur. Discharge from the nipple, dimpling of the breast. These are all symptoms that you cannot ignore, ever. The skin changes to that breast on the outward appearance is indicating that there is something going on inside. It is very important to have this checked out. If you are over 40 and you are at a higher risk of breast cancer, and you know that, you must every year have a mammogram. In understanding breast cancer, and know that there are risk factors. Understand how cancer develops, but also understand that there are tests and screenings that will help you to help to diagnose and monitor and treat breast cancer. Mammograms, ultrasounds, MRIs, CAT scans, PRT, these are all individual ways of understanding breast cancer, and they're all ways that you can take to determine what your risk factor is and what your health is at any time that you make that appointment to go in and have yourself checked out. I hope I have helped you all understand why we need to keep a healthy diet, healthy exercise, and what your chances are of developing breast cancer. Thank you.